हेलो फ्रेंड्स, आज का हमारा टॉपिक है हाइपोकैलेमिया. सो व्हाट इज़ हाइपोकैलेमिया? व्हेन द नॉर्मल पोटेशियम लेवल इन द सीरम इज़ नॉट मेंटेन्ड एंड इज़ लोअर देन द विंडो, देन इट इज़ हाइपोकैलेमिया. मतलब जो हमारा नॉर्मल पोटेशियम लेवल है सीरम का, वो है 3.5 से 5 मिली इक्विवेलेंट पर लीटर तक. ओके, जब इस विंडो से कम होगा हमारा सीरम का पोटेशियम लेवल, तब उस कंडीशन को हम लोग हाइपोकैलेमिया बोलेंगे. ठीक है, इसका क्या क्या कॉजेस हो सकते हैं? तो कॉजेस जो है मेन 3 हेडिंग्स में आएंगे. 1, अगर वहाँ पर हमारा पोटेशियम लॉस होगा तो. सेकंड, शिफ्ट ऑफ पोटेशियम्स इनटू द सेल्स फ्रॉम द सीरम. 3, लैक ऑफ पोटेशियम इनटेक. ठीक है, तो 1 क्या हो गया? पोटेशियम लॉस हो रहा है फ्रॉम द बॉडी. ओके, ये लॉस कैसे हो सकता है? इट कुड बी आइदर इन द फॉर्म ऑफ डायरिया, कुड बी इन द फॉर्म ऑफ वॉमिटिंग, nasogastric suctions, there could be diuretics being used, there could be hyperaldosteronism, which is Cushing's syndrome, there could be excessive sweating like in diaphoresis. ठीक है, तो फिर ये कंडीशंस में क्या होगा? द पोटेशियम विल बी लॉस्ट फ्रॉम द बॉडी. ठीक है, नेक्स्ट क्या कंडीशन हो सकता है? देयर कुड बी शिफ्ट ऑफ पोटेशियम इनटू द सेल फ्रॉम द सीरम. कैसे? लाइक इन case there is an increased insulin level in the body, okay, when there is alkalosis taking place, right? So in this cases we can see there is a shift of potassium inside the cell. Next, there could be lack of potassium intake, like when the client or the person is going through starvation, he is fasting, okay, or in an NPO status, nothing per mouth status, then also that person can suffer from hypokalemia. Okay, next we move to the clinical manifestations. What are the clinical manifestations here? The patient will be suffering from fatigue, there will be muscle weakness, there will be nausea, vomiting, there can be paralytic ileus because there is potassium is required for the proper peristalsis of the gastrointestinal system. There could be hyperglycemia. Okay, what will be the ECG changes in case of hypokalemia? A characteristic change is that there will be ST depression, there will be a prominent U wave, right? There could be a slightly prolonged PR interval and a slightly peaked P. Okay, there would be a shallow T wave, which is just opposite of what we saw in hyperkalemia. There we have a T is peaked over there, but over here the T is shallow, whereas there is an ST depression in case of hypokalemia, right? Now coming to the interventions, what we have to do? We have to monitor the serum potassium level very closely. We can administer potassium supplements either orally or through IV. Okay, we have to measure take safety measures. Why? Because their hypokalemia means the patient is at a risk of various type of muscle weakness. That means he is or she is at risk of injury. Okay, so we have to take safety measures. Okay, next is we have to take into account of potassium sparing diuretics instead of using potassium losing diuretics, because we have to preserve the potassium in the body right now. Okay, one very important point while we are administering potassium supplements, if we are administering it orally and the patient is experiencing excessive vomiting and nausea, then we have to make sure we are not administering potassium orally on an empty stomach, because it could lead to gastrointestinal irritation and even bleeding. Okay, so in that case we have to discontinue it per mouth and we have to go for IV administration of potassium. Okay, if we are going for an IV administration of potassium, we have to make sure the potassium is given in a diluted form and administered through an infusion device. We will not give a bolus of the potassium at once. Okay, it is contraindicated, and will not give IM or subcutaneous potassium for that patient, right? Sometimes if we are administering oral potassium, we can go for liquid potassium chloride Okay, but as it is very unpleasant in taste, so it could be mixed with fruit juice, right? So these are the conditions for taking potassium supplements. So that was it. If you like the video, please subscribe the channel and stay tuned for more such videos. Okay.